Hi everyone! Welcome to Medicine for Dummies. I'm Dr. V. Today we are starting a new series of videos on medical disorders. Of course, these will still relate to some of the topics we discussed in pediatrics, and some of the topics in pediatrics will also be seen in adult medicine, so these videos go hand in hand. Of course, don't forget to like, subscribe, and share, and comment below if you want any other topics covered. Today, our topic is typhus fever. Don't confuse this with typhoid fever, which is a different clinical entity. This is a group of infections caused by rickettsial organisms, which are bacteria. These infections give rise to an acute febrile illness and are important differential diagnoses in anyone presenting with a short duration of fever. These are transmitted by vectors, which are basically animals or insects that transfer an infection from one host to another. The usual vectors are fleas, mites, ticks, and body louse, and the vector is different according to the infection. Here, you can see a table with all the types of typhus fever, the causative organism, host, and their vectors. There are two main groups of typhus fever. The first group is the typhus fever group, which includes epidemic typhus, murine typhus, and scrub typhus. The spotted fever group has African tick typhus, Mediterranean spotted fever, Rocky Mountain spotted fever, rickettsial pox, and flea-borne spotted fever. The most common group is the typhus fever group, and as you can see, the relevant organisms are Rickettsia prowazekii, Rickettsia typhi, and Orientia tsutsugamushi. These are transmitted by the various vectors demonstrated here. Before we move on to the disease itself, we should know a bit about the vectors to understand the disease better. There are four main types of insect vectors involved in transmitting typhus fever, as I said before. These are the body louse, flea, mite, and tick. The body louse and flea each have 6 legs. The differentiating factors are that body lice have claw-like structures at the end of their legs, which enable them to hold on tight to hair and crawl. Fleas, on the other hand, have the ability to jump almost 7 inches from the ground, and their hind legs are strong and long to enable this, as you can see here. Mites and ticks both have 8 legs each in their adult stages. The difference is that mites don't have a divided body, and they are usually hairy and smaller than ticks. Ticks do not have hair, and their body is divided into 3 distinct areas, as you can see here, which are the head, thorax, and abdomen. So, what happens is these vectors have the relevant rickettsial organism in their alimentary tract. When they take a blood meal, these vectors defecate on the skin, and due to the bite, there is an intense pruritic reaction in the skin, which causes itching. The itching will cause skin breakage and enables the bacteria to enter into the bloodstream and multiply within the endothelium, which will ultimately result in a vasculitis. This will hence lead to a variety of symptoms in the host or the human. A lot of constitutional symptoms can be seen, like fever, headache, conjunctivitis, malaise, and myalgia. At around day 4 to day 7, they can get a rash, which is maculopapular rash. It usually starts in the thorax and abdomen and extends to the extremities. At the bite site, you may see an eschar, which is an area of necrotic tissue that later scabs off. It is important to look for this as it is almost diagnostic of typhus. You may also see regional or generalized lymphadenopathy, and rarely other features like splenomegaly, meningoencephalitis, myocarditis, pneumonia, or gangrene. Gangrene is seen in severe forms of the disease where the vasculitis causes end arterial thrombosis leading to ischemia. So, in a patient with this array of symptoms, the condition is diagnostic, as usually typhus fever is a clinical diagnosis. You can confirm the diagnosis by serological testing, and in a full blood count, you may see leukopenia in early stages and later leukocytosis, as well as thrombocytopenia. The management is by giving antibiotics, as this is a bacterial infection, and usually we have to give either doxycycline or chloramphenicol up to 3 days after the fever has subsided. Doxycycline is usually not given to children as it may cause tooth staining when given to younger children. So that is all you need to know about typhus fever. It is important to note that there is no sex or age predilection for this disease, and the epidemiology differs according to the region. It usually responds well to antibiotics, and at the present day and age, if diagnosed early, it has a very good prognosis. To learn more about interesting topics like this, keep tuned. Thanks for watching!